Hey everyone, I welcome you to Find Learning, and today we are going to know about Omicron, the new variant of coronavirus. Now the question arises over here is why the Omicron variant is so dangerous? What makes it so dangerous that it is becoming a kind of fear in the world right now? What is leading to that fear and what is causing that fear? Today we are going to answer some of the questions looking at some very genuine materials, that is both from WHO and other agencies. Let's start our topic. Then the question first thing is definitely why the Omicron variant is so dangerous. Then at present, in the present moment, if we look at the data, then WHO is still coordinating with various research organizations around the world to understand Omicron. Right now, it's not very clear that what Omicron is and why it is becoming so dangerous and why it is creating havoc around the world, especially as it started from South Africa and the cases started going very high over there. More and more people are getting infected, and that is the reason of concern. That is what is causing the concern that Omicron can be more dangerous than even the Delta variant, which actually was one of the very dangerous of all till now we know. So the now focus is on Omicron. So till now, according to WHO findings, there could be the increased risk of infection with Omicron. So the risk of infection could be high when it comes to Omicron. That is one of the main reason. And also the Omicron has many more mutations than Delta variant. And this was the image which I'm just going to show you. It is Omicron as detected in South Africa, and research is done by prestigious Bambino Gesù Hospital of Rome. So now you are going to see the image that how these are the two mutations. This is Delta variant and this is the Omicron. So you can see how much both are mutating. If you will see here and over there, let me change. Okay, if you can see over here, and these are the regions where the Delta variant mutated. And when you are seeing the mutation over here, look at the amount of mutation this Omicron is having. So because of these high level of mutation, what we are seeing is that there could be the reason of very high number of infection among Omicron patients. Those who are getting infected with Omicron, they can actually get more. The number of people who could be infected by Omicron could be higher. And what we are doing till now, giving vaccines, trying to create the infrastructure which is against this condition of coronavirus. We are trying our best to create those infrastructure, those conditions where people can start living normally like earlier. But if such kind of conditions prevail, conditions like Omicron, where there is continuous mutation is happening, these conditions are going to make things worse. They are going to make things difficult again. So how we can control it, how we can do it, we don't know anything more about yet. The most proven way is wear your mask, stay away from crowd. These are the proven things, and these are really the things we should follow up to the time till the time the information clearly uh, comes to us and we can have a clarity over the issue. So up to then, what we can do minimum is that we can at least try to stay away from the crowded places and definitely wear the mask. Now the Omicron is recently discovered variant of coronavirus and has made government across the world anxious. Yes, definitely made the government around the world little anxious due to its rapid transmissible nature. Its rapid transmissible nature is making governments around the world anxious, as again there could be more and more lockdown, losses of businesses. Losses of businesses means the loss of that country, the slowing down of economy, and everything going negative, what we just saw in the first and second waves of coronavirus. So again, this Omicron can create the same havoc to us, to our businesses, to our economies. So government need to panic. Governments are panicking. WHO has already declared Omicron variant as variant of concern, which means that people should be careful with this variant. I mean, really taking the care what they needed, taking all the important measures, what is needed to safeguard themselves against this virus. So yes, all these things need to be done to fight against variant has sparked fears. Yes, definitely. 2-year-old coronavirus pandemic, we all saw how it happened. So as a result, dozen of countries has brought the shutter down to contain new phase of pandemic. As if the disease spreads in their country again, it's really going to cause huge losses, both of people and the economy and the money and the businesses. Everything is going to really suffer some huge losses again. So many countries, mostly in Europe and Americas, most countries are closing down. Most countries are banning international flights, especially from African countries. So yeah, things are happening again. They are trying to save themselves. So yeah, panic, you can see panic situation everywhere. Now, how dangerous is Omicron variant? Now WHO answers how. It is not the clear answer, but definitely WHO tries to give some hints over there. Like WHO is coordinating with large number of researchers. Studies are still underway. Vaccines and diagnostics are happening. Its effectiveness are being checked. that how the treatment is reacting over the people, how the treatment is affecting people. So yeah, things are happening, but yeah, it will take time. It takes time. The recently found Omicron is creating panic, but WHO is trying its best, and we should try our best to avoid the conditions which can give us coronavirus. Try to reduce traveling, work from home if possible. All these things can be taken as precautionary measures. So WHO findings, like there may be increased risk of infection with Omicron. Like their thing is that maybe, as we still don't know, as in the area where the Omicron is found, more and more people are getting infected, and that is why this maybe is there, that yes, there could be the reason that more and more people are getting infected, and there could be the thing that Omicron is highly infectious. But still, till all the research results are not available, we cannot say for certainty. That's why the maybe is there. That's why the maybe is created here, maybe is written here, so that we cannot take it for sure unless and until all the results are given to us. But with this maybe also, what we need to do is we need to be more and more careful. Okay, so the next thing is that regarding the nature of new variant. Okay, nature of new variant is that it is advised to all the countries that public health measures of the COVID-19 should be upgraded. All the countries who are slowing down on the measures of COVID-19 should need to upgrade their facilities. They need to vaccine maximum number of their population. So all these things are happening. Countries need to stay on their toes. They need to be well prepared. If anything happens, if anything serious comes out, they have to be ready. So WHO also has said that it is unclear, that it is still unclear that Omicron is more transmissible, or it can cause more severe diseases compared to other variants. It is unclear, but it includes highly transmissible and globally then compared to the earlier Delta variant. Sorry, that look, the WHO is still looking at how much this Omicron is transmissible from one person to another compared to the earlier Delta variant. What are its symptoms? And what are its end results? Like, are more people getting killed with this Omicron? And what are the other things? So WHO is still looking into all these things. And finally, WHO also says that it is trying to understand the potential impact of variant on existing countermeasures, like whatever the countermeasures we are taking, like giving vaccines, and also the cocktail medicines which we have created. We have tried to understand the food patterns. So what are all these measures what are all these measures getting how are all these measures getting impacted by this new virus? So scientists are still looking into it, and how it can dominate the Delta virus also, that how it can be more dominant than Delta virus. All these factors are being looked into. Until then, we need to stay put. We need to we need to do our best. We need to try focus on those areas which we can prevent by ourselves. Like, we can definitely wear the mask. We can definitely avoid the crowded places. That is what we should do. And if we look at the website of WHO also, what they are saying. So let's see what WHO has to say. Well, this is the website of WHO. Now, what they are updating on Omicron. Well, on November 26, 2001, WHO designated B1.1.529 variant as Omicron, and and also called it the variant of concern. Okay, so this is its scientific name. If you can remember for any exam, if you want to remember, B.1.1.529. So now it is named as Omicron, and there is technical advisory over it. Okay, there is technical advisory over it that this is among group of virus of evolution. It has evolved into a new virus from it, as it started from the basic corona. Now there are many variants of it, and one of them is Omicron. Now, what WHO has current knowledge over this virus? If we can look into that issue, that what is the current knowledge of WHO on the virus, then we'll see that transmissibility, still WHO is unclear about the fact. Then if we look at the other factors like severity of the disease, like how severe the disease is according to WHO. So again, WHO is still not clear, but where it was found, like it was found primarily in South Africa, there the cases are continuously rising. So WHO assumes that yes, this could be far more infectious. Also, the effectiveness of SARS-CoV-2 infection, effectiveness of the vaccines, if in that manner, if we see that WHO also thinks that all the evidences right now the evidences whatever we have, they definitely suggest that there is increased risk. Look, the risk is very high, so we have to be careful. That's what WHO suggests right now. Now, what about the effectiveness of vaccines? Right now, vaccines are definitely working, but there is still the results to come. The results is to come on Omicron. That how dangerous the Omicron is, how much it can cause the damage, how much the vaccines we are using right now is effective on this variant. Do we need booster doses? All these things are still looked into, and definitely we will be informed accordingly very soon. But right now, stay put, stay careful. Another things is that current test test giving the accurate result of this disease, this Omicron variant. All these things are being looked into. Effectiveness of current treatment, like whatever the treatments going on right now, how much are they effective on this Omicron variant. Now the studies are definitely underway. WHO is studying this virus. It is studying this virus, and definitely the results will be available to us very soon. Recommendations are definitely stay away from the crowd, as I have said earlier. Wear your mask, eat healthy foods, keep vitamin C in your diets. All these things are important. So this is right now the basic information, the information which we have available both from WHO as well as from the other sources. So what we need to do is we need to follow these information. We need to try to keep our cool. We need to, whatever this condition is, it is difficult times. We need to try to do our best to save ourselves. If we are saving ourselves from the disease, we are also saving others. We are saving people around us also. So we have. If you liked our initiative, subscribe to our channel, like our videos, share it among your friends, and till then, keep studying, enjoy your day, have a nice time with your friends, and wear the mask, stay away from crowd, live happily. Thank you, and have a